নমস্কার, জি 24 ঘন্টায় আপনাদের সকলকে স্বাগত জানাচ্ছি। আমি সঞ্জয় ভদ্র। আমাদের এই বিশেষ হেলথ কনক্লেভের অনুষ্ঠানে এই মুহূর্তে আমাদের হেলথ কনক্লেভে যাকে আমরা পেয়েছি, যার সাথে আমরা কথা বলবো, তিনি বহু বিখ্যাত ব্যক্তির সুস্থভাবে হাঁটা চলার নেপথ্যে যিনি রয়েছেন সেই ডক্টর সঞ্জয় দেসাই। ডক্টর সঞ্জয় দেসাই, ওয়েলকাম টু আওয়ার হেলথ কনক্লেভ শো. Like before moving on to anything, Dr. Desai, whatever our viewers will like to hear from you, one of the most credible voice of the health industry, I would like to ask one question, which is probably everyone is asking. Like a doctor, I want to ask from you, how do you rate, how are we fighting the COVID scenario in India? How do you rate our fight?
I think we have done extremely well, keeping in mind with the massive population burden that we have. It is really commendable that the government of India support to the health industry and to all the doctors and the healthcare centers has been tremendous, and what we have achieved is remarkable.
Okay, Doctor, one thing I would like to take up, one particular topic about the vaccine hesitancy we have been seeing, not only in the rural sector, but even in the semi-urban and urban sector. We have seen vaccine hesitancy, the quotient is there. So, like a doctor, what will be your message to the general people?
I think first of all, the vaccine hesitancy has been very low, fortunately, in our country, if you compare it to Europe and United States. And I think the media has played a very useful and important role in spreading the message that one must get vaccinated. It is not harmful, it will help you, if not prevent you from getting COVID infection, but at least reduce the intensity of the disease and may avoid you having to go to the hospital.
Okay, Dr. Desai, one more question, as because you are very specialized in the orthopedic department. One question, how do you see the effect of COVID in our bone density? Does it really have any impact in our bone density?
Not on bone density, but I have seen in the last 18-20 months that a lot of patients who have had COVID infection do come with arthralgia, which means they come with multiple joint pains which seems to remain several weeks or maybe months after the COVID infection. That is number one. Number two, okay, there has been a very distinct increase in what is called as frozen shoulder following COVID infection. Some patients have said that they got the vaccination done on that shoulder and then it became frozen. It's very hard to attribute the frozen shoulder to the vaccine shot given on that arm, but there is a certain increase in joint pain and frozen shoulder following COVID.
Okay, so Dr. Desai, just as our India is grappling in an epidemic situation, apart from that, we do know that we have a problem of deficiency of vitamin D as a whole in a large populace of our country. So why we are so prone to this? What is the way out?
I think one of the reason is pollution. As we all know that vitamin D is synthesized or manufactured in the skin as a result of sun rays. Now the problem in our country is because of pollution. I don't think that the healthy sun rays are reaching our skin, and that probably is one of the main reason behind the sudden drop in vitamin D across the country. So we must, as everybody is well aware, that environment pollution is the key for our country and the world.
So you are saying that population is one of the key factors that we need to keep it in our mind. So do you see that government need to be very proactive on this part so that our large populace doesn't have the deficiency, this problem area?
Absolutely, I think, and the last data that we see, there is a slow decline in the rise of population, which is good. I think the government and the media are very proactive and working very hard to educate people, especially those in the villages and rural areas, about population control and contraception.
Okay, Dr. Desai, I think most of our viewer will like to know about one particular thing that is related to the women health, that is osteoporosis. Like what they need to do to avoid this, because we know a large section of the women populace is prone to this. So, as a specialist, what will be your suggestion to the women of our country?
I think a healthy woman in the family is absolutely paramount for the health of the whole family. She is the backbone. And one of the unfortunate thing about our culture is that a woman is somebody's daughter, somebody's sister, and then somebody's wife and somebody's daughter-in-law, and she hardly devotes any time for herself. So it is extremely important that all of us, particularly the male population, realize that we must give women a time of their own so that they can concentrate on their health as well. And besides diet, giving an opportunity to the women population to exercise regularly is so important, not just for her health but the health of the whole family.
Okay, nice. Well, the point taken. Dr. Desai, one more thing. We as a nation we are often being said that we as a nation are very less concerned about our bone health. Is it true? As a specialist, you see scores of patients every day. What is your take on this?
You are partly right that we as a nation are not as much health conscious, but the things are rapidly changing. As I see it in my own practice over the last 30 years, there has been a tremendous change in the young population. They are all very health conscious. They are extremely aware of what to eat, what not to eat, what is unhealthy diet. If you see the number of gymnasiums that are mushrooming across the country, is a very good reflection that how the young population is very much abreast with the fact that exercising and remaining fit is key to their own well-being and that of the nation.
Dr. Desai, as you are saying this, I want to ask you one more question probably related to this. Is that when it comes to knee replacement or the ligament replacement surgery, we see a lot of people are still skeptical about this, but there has been a huge advancement of the technology in this side. Even we have an n numbers of specialists also, but do you really think that we need to worry about it? People need to be so skeptical about it?
No. I think knee replacement now is a very standardized procedure with predictable results. I would be bold enough to say that the whole orthopedic advancement in the last 100 years can be divided into pre-replacement era and post-replacement era. Knee replacement, hip replacement and shoulder replacement. These three have become extremely standardized with excellent results, and you will be surprised that the number of joint replacements being done across the globe will be close to almost 1 million a year. Human beings are undergoing joint replacement every year across the world.
Dr. Desai, I would like to take one more point in this regard. Like advancement in technology causes expense that we know. Can there be something called affordable advanced healthcare? Can it be achieved?
Absolutely, it can be achieved, and there is no better place in the world than India to achieve this. I think what the government should, and I think they are already aware, is try and tie up with multinational companies for these healthcare products to be manufactured in India. That is the first step to bring down the cost. Number two, the doctors and the hospital administrators should try and encourage particularly the doctors, to adapt only those things which are really going to make a difference in patient care, and not necessarily ape or copy everything that the Western world does. For example, using disposables during the operation, it increases the cost like anything, and it increases the amount of waste that we produce. So look at United States, they are one of the largest producers of waste in the world, and it's a big problem how to dispose of this waste without interfering with our environment and nature. So we must be conscious that adapt certain advances in technology from the Western world, but choose and pick what is suitable to our country and the environment.
Okay, so one more thing, as we have you in our show, and people must have lot of expectation from hearing a lot of words from you. One more thing is what are the most important thing one should keep it in mind, their knee, to keep their knee joints safe. Can we have some tip from you?
Very much I'll be happy to share. There are just two important things: maintaining body weight, which is crucial, and regular exercises to keep your joints mobile, supple, and the muscles in good shape. So in summary, diet and exercise are the key to have a healthy joint till you live.
As you see scores of patients every day, how do you think, what is the age that one tend to develop a knee problem, according to your experience? Can you please share with our viewers?
Yeah, so age related wear and tear, what is called as age related degeneration or osteoarthritis, it starts, the process initiates around 45-50 age group, and then slowly it progresses. If you have had injury to the knee in your younger days, then the arthritis begins a little premature or earlier, but an average age is 45-50 when it starts, and then it goes on progressing. Of course, the genetic background has a role to play. Your constitution, your body weight, your lifestyle, all these factors also have an impact on how much your knee joint will deteriorate or degenerate in your 60s and 70s.
Dr. Desai, as we have you in our show, I would like to ask you one more question. We would like to be enlightened about one more thing, is that arthroplasty, what is the advancement of it right now in an Indian scenario?
Arthroplasty is, for your viewers' sake, arthroplasty is the medical term for joint replacement. Did you say arthroplasty?
Yeah.
Yeah. So that is the medical terminology for what is commonly known as joint replacement. Now I want to make your audience aware that most people only have heard about knee replacement or hip replacement, but the fact is that shoulder replacement is at par with the knee or the shoulder. I have scheduled a shoulder replacement tomorrow. Patient has come from overseas. So this is just to give you an idea that how rapid the advancement in medical science, particularly orthopedics and joint replacement is, and shoulder replacement results are as good, if not better, than knee or hip replacement. So it's quite a routine operation in my practice.
Okay, so do you see that people are responding to this new advancement, new advancement in this medical field? How do you see? What is the people's reaction, patients' reaction to it?
Unfortunately, these very advanced techniques such as shoulder replacement, let me add that there are almost 4 or 5 different varieties of shoulder replacement that are available in the market in India, and we do it quite regularly. But unfortunately, all these technologies are essentially in the metros. It has not yet penetrated the interiors of our country, and that I think will take time, as is very typical of a developing country like ours. Currently, our nation's need is primary health care centers in the interiors. That's the first step before we start targeting very advanced technology into the interiors. And what we really need is low cost government or municipal hospitals in every nook and corner of the country. We really at this moment don't need 5-star hospitals. There are enough of those.
Okay, Dr. Desai, we have had a lot of wisdom from you, and I'm quite sure that our viewers will be very happy to hear your voices. And one last question to you, probably this is one of the most asked question to you is how is it to be the treating doctor of like powerhouses like SRK, Sonia Gandhi, or Sharad Pawar? So how do you think? I know it's on a lighter vein, but I just want to ask you this question.
Well, if I'm honest with you,
Yeah.
when you are dealing with the so-called high-profile patient, initially there is a little bit of anxiety, though you are doing that surgery day in and day out, and you are supposed to be an expert in that technique. But initially, I must confess that there is some anxiety. But I must also tell you that once you enter the knee joint or the shoulder joint, I am completely at home. I am at peace with myself, and I do the surgery in the same way that I would do with anybody else. And thank God that from the inside, the joint is same whether you are a high profile or not a high profile.
Yeah, a patient is a patient. Dr. Desai was very candid about it. It is very inviting, but again, a patient, maybe he or she is a high profile or just a common man, but for a doctor like Dr. Desai, is just a patient and a common person, a doctor who wants to treat each and every patient in the same spirit. Thank you, Dr. Desai, for being in our Health Conclave show. Thank you very much.
Thank you for
धन्यवाद
inviting me.
আপনাদের।
Thank you.